a patient come to the OPT with abdominal pain and malabsorption like symptoms, with dark pigmentation of the skin. But the culture is negative. So you did an intestinal biopsy which gave you gram-positive tiny little microorganisms. It is Whipple's disease. Let us talk about Whipple's disease today. Hello guys, let us talk about Whipple's disease today. It is caused due to mainly organism Trophirima whipplei. It is a bacteria from Actinobacter family and it is gram-positive. It's important to note. The generation time is very slow and the incubation period is about 30 days. The main thing to note down is it cannot be cultured. So mostly involve elderly people, elderly and middle-aged people. It mostly involves males than females. It is a multi-system disease and chronic. The studies have shown it is most in proximal intestine, small intestines, than distal intestine. It occurs in both but mostly in proximal intestine. You have to remember this point that lymphadenopathy is definitely present. Whereas some disease like tropical sprue and celiac disease, lymphadenopathy is not present. So you can rule out Whipple's disease by lymphadenopathy. Coming to clinical manifestations, as I said, it is multi-system disease. It involves joints. So here distal joints are involved, knee, ankle and wrists, and it causes small joint arthritis and migratory intermittent oligoarthritis. Coming to GIT, you know that lymphadenopathy is present. You'll have swellings in lymph node and abdominal pain and malabsorption syndromes. In CNS, among 40% of the patient, we can see CNS. So it causes dementia, and the most specific sign of CNS involvement in this Whipple's disease is progressive supranuclear palsy, which is also called as down gaze palsy, and it also have oculomascatory or oculofacial myasthenia. It is nothing but that old person, the patient will have ocular eyeball movements, and also they'll have locked jaw like features like the jaw movements. Opsoclonus and myoclonus. It is nothing but same involvement of eyeball movements, and lightning like jerks of limbs. So this CNS involvement in Whipple's disease have bad prognosis. Coming to CVS, mitral valve is involved. First, endocarditis is affected the most, with myocarditis and pericarditis. So as I said, culture will be definitely negative, but also when the vegetations are present in valve, you have to consider the heic organisms more than Whipple's disease. But you can have culture and biopsy and look in microscope. Coming to definitive diagnosis, just take biopsy of intestine and do endoscopy, and PCR will help you with finding out the Whipple organism. As I said, it have gram positive in nature, and these are present in macrophages, as you can see here. Macrophages and with the gram positive organisms. The villi are enlarged and filled with foamy macrophages. Let us talk about the treatment. We give 14 days treatment of ceftriaxone or meropenem. The long-term therapy, if involved CNS, clotrimazole. It penetrates CNS, and hence you completed Whipple's disease. I hope you like this video. Like, share and subscribe.